Hi, my name is Thor, and this is my community advocacy project on loneliness and depression in Austin, Minnesota. This is my introduction page. You can see all the various categories we're going to be covering there, and this awesome picture of Austin's water tower. So, why depression and loneliness? Well, 1 in 5 Americans is going to experience depression. 1 in 3 do report feeling loneliness. Both do reduce overall quality of life for these individuals. They decrease societal productivity and increase healthcare costs, especially in the long term. Loneliness is a social issue, but it is also an increased health risk factor that contributes to worsening mental health because it limits people's ability to cope and it decreases overall quality of life. And both of these are prevalent in all age groups, but particularly in elderly people, people with disabilities, low-income households, and minority populations. The purpose of this project is really to assess Austin's community health needs, examine the incidence and prevalence of loneliness and depression in Austin, identify what Austin's risk protective factors are, and a windshield survey to kind of look at the entire built and natural environment in Austin, what resources available to the population there, and then propose a public health intervention to help out with this. To define the problem, depression is a sense of persistent sadness, lack of interest, despair that kind of lingers. It has effects on physical, emotional, and social well-being. And then loneliness is that negative feeling when there's like a difference between what someone wishes that their social interactions were like or relationships were like and what actually exists. And then that can increase stress levels, decrease ability to cope with especially any sort of life difficulties, increased stresses, or even health issues that one might be going through. At a community level, these two combine to reduce overall society productivity, which actually has a big financial toll. In the United States, this combined effect costs over about $380 billion annually. So what's the incidence and prevalence? Well, Austin reports levels of depression at about, you see a little over 1 in 5, which is more than the national average there. And loneliness at about the Minnesota rate, and a little bit less than US average, but pretty on par for all those stats. Specifically, older adults are vulnerable to this in terms of the loneliness, bereavement, physical disability, the inability to move. If they're in a kind of a elderly care facility, they might have a fixed income, and reduced access to reliable transportation. The LGBTQ or other minority groups also are at risk for this just due to social stigma, isolation, lack of catered resources, or familiar support sometimes. Immigrant communities, cultural differences and gaps in understanding, sometimes the health knowledge deficiencies, obviously the language barriers or financial barriers might be present, which goes right into low-income households that are also at risk for this due to those financial barriers, education deficiencies, and sometimes the inability to even access healthcare. And of course, we have individual disabilities. Those are just either mental or physical that prevent them from either being able to travel easily or interact or have social barriers that prevent them from being able to access a lot of these resources. For this right here is a great social vulnerability index map from Policy Maps. And you can see that a good part of Austin falls in the high and medium risk areas for vulnerability index, which has to do with economic status, household income, compensation, minority status, language, any sort of things like that. Housing and transportation are big ones that factor into this. The epidemiological triangle for loneliness and depression. The host, the causative agent, and the environment there. The host is basically adolescents and older adults are some of the highest risks of all age groups, but then again, the vulnerable populations are another one of those. The causative agents can be a history of trauma, there can be abuse going on, chronic illnesses can give a sense of depression and reduce quality of life that can increase these risks for this. Brain chemistry is also a reason that can cause depression in some individuals. And then a negative self-image, that's another one. Environment would be poverty that creates kind of that low-income household and lack of access, your social isolations for especially our more rural population there, and then that limited healthcare access to actually address these things, and then the cultural barriers that can also create a barrier to that. Loneliness itself right here, as you can see, is also a risk factor that increases decreased coping and then leads to more depression. So itself is kind of like this domino effect. So here's the windshield survey I did for Austin. Now keep in mind, this was right before July 4th, so there was a good bit of rain happening here that day, so it doesn't always look this wet and dreary there. But I decided to start with the industry and built environments in Austin. And this one at the top here is kind of some of where the main income of Austin goes. And this is Hormel Industry. This is the big industrial factory right off the highway there. Hormel Foundation is one of those big Fortune 500 companies, one of the few Fortune 500 companies that actually stayed in its original hometown. You also have the big Mayo Clinic here, which has a large presence in Austin with the big healthcare facility there. And then you have all the downtown here, which is all the various shops, the walkable downtown. There's a lot of that, and that's more of the kind of that built money environment that I took a couple pictures of there. In terms of community resources for the built environment, you have like the Salvation Army here in the top left. The top right shows one of the many various churches. This is one of those big churches downtown. It's actually a really beautiful building there. Bottom left here, we have the Community Actions Building. This is a great place where there's a bunch of small organizations and committees that specifically meet to address things like the more vulnerable populations, people with knowledge deficiency, helping our immigrant communities to access all the things they can. Anybody who can come here, they try to reach out to them. And of course, the YMCA is always a great community access for a lot of all the physical classes they have there, the gym, the pool. It's a great place for a lot of people to access a main source of something like that. And then here we did a lot of the natural environment. Again, it's not always as flooded, but there's a couple great parks in Austin. There's some nature centers here, big ponds that'll have good fishing in them as well. You have some great playgrounds here, and there's a couple of playgrounds even have like workout equipment in them. You have this huge public community swimming pool there. And then down here, the Banfield Event Center is where like they did the 4th of July stuff. They do big music festivals and such here. So it's a great place for community events to occur. So some of the protective and risk factors for Austin. So some of the protective factors that are already in place in Austin that are great for the population there is that the Mayo Clinic Health Systems, being a nonprofit, is actively involved in doing its own community health needs assessment and has an action plan that they have to produce every couple of years there. So a lot of these things are being researched and actively addressed by them. There's multiple parks, like I said, walking trails, playgrounds, there's disc golf courses, there's fairgrounds, there's a really nice walkable downtown, bike paths, there's a couple sports arenas as well, and then of course the little lakes downtown and all those fishing ponds. There's those community organizations like the YMCA, the community action buildings, the Salvation Army, you get the American Legion, your various faith groups there. Then you have these cool community events that they put on all the time too. You have the Pride Festival that's recently started up there. You have the Art Festival that happens on a regular basis. You have holiday events, cultural events. Really awesome when they shut down all of downtown and have big community events there. And then they have a lot of social opportunities for people to access of all different interests downtown. So some of the risk factors though, the transportation is a huge barrier there. As you saw on that map with the social index there with the people who are at risk, it's a lot of Austin, and particularly people who are out in the more rural areas, their lower income areas there. There is a public bus that's in Austin, but it really only runs down the main roads. It doesn't actually access a lot of the smaller neighborhoods there. That's a lack of public transportation outside in the downtown area there. There's still a mental health stigma. This is changing in the US, but does still exist, and a lot of people don't access the mental health they probably need or even acknowledge it. There's a limited provider access. They have nearly half as many per 1,000 people in terms of primary care and nurse practitioners than the state average. Poverty is a big one. As you saw, there's a bunch of communities that have higher risk factors there. Healthcare affordability is always kind of a factor. And then the social isolation, either cultural, the physical isolation for elderly people, and then of course the more rural location that kind of can isolate people as well. So there's many Healthy People goals related to mental health in the 2030 project. The one I chose is to reduce the proportion of adults with disabilities who experience serious psychological distress. Now I chose this one because it approaches both loneliness and depression, in my opinion, that in terms of disabilities relates to those with physical disabilities, like elderly people and those who cannot travel easily, and mental disabilities. And again, both of those things are kind of increased risks of loneliness, which then increase risks of depression. And so because these disabilities impact the ability to access these community events and healthcare resources, which contribute to that isolation and lack of care. So that's why I grabbed that goal. And then a public health intervention for this would be something that could address the lack of access that these communities, these at-risk vulnerable populations have to all the protective resources that are already available in Austin. Given that this is a SDOA transportation address, that was addressed transportation, this does hit the primary level of prevention as it addresses that upstream social determinant of health, which factors into a lot of things that improve quality of life. There is some secondary level of prevention as it would probably allow access to ongoing screening for already known conditions and ongoing care, and then preventing worsening of existing health conditions, right? The target population: older adults, individuals with disabilities, rural residents, low-income households, LGBTQ youth, immigrant families. And because of that, you would have case management, managing all these people, finding out who's in need, collaborating with all the local partners and maybe a primary care to find out who's the most at need, outreach, making sure that people are finding out about all this, and then advocacy, making sure you're advocating for this being a service for the individuals here. So what would my public health intervention be? It would probably be like a connecting Austin transportation center kind of like program. It would be something that had accessible ride request system, flexible destinations, not so much like an Uber because those are getting more private, those are expensive, and not like a medical ride service because this would not just be to the doctors and back. This would be something that you could do to go to the grocery store, to go to community events, just to go downtown, just to go to access the Y or go to anything like that. So this would be far more flexible, more just a replacement to allow people to get out of their homes and actually access, maybe just go to the park for a day, those kind of things. You would need a good sliding scale for cost on this. Obviously, lower income, charged a whole lot less. Maybe partnering with Medicaid and Medicare, see if that could work into coverage here because it would be promoting health, right? A community partnership, obviously, would need maybe probably volunteer drivers and vehicles and stuff like that. And then a referral system. This would be where you'd probably work with local primary care providers or mental health care providers, and so they could help identify prime candidates for this. And then your partners possibly would be like Malheur County Public Health, your YMCA, or other community organizations. The Hormel Foundation, as they fund a lot of these programs there, and they're one of those big corporations around there. The Mayo Clinic Health Services, obviously, this would be healthcare providers. A lot of that push there. Austin Public Schools, faith communities. If people are trying to get to Mass or anything like that, that'd be a great way to get them to those places. Barriers, of course, with anything like this is going to be funding, driver availability, transportation regulations. I'm sure there's some red tape there. Scheduling complexity. Obviously, if you get a whole bunch of requests happening all at once, how you decide, who's the priority need there. And then, of course, getting community awareness, making sure people are aware of this, what this program is, how it's helping, who it's serving. Solutions to a lot of this would be local and federal grant programs, seeing who's there, who's already giving money, what grants are already available to help promote this kind of thing. Community partnerships, like I said before, with some of those bigger foundations, maybe the grocery stores, the organizations around there that are running the events, making sure that they are making the people aware of it at these centers here. Or make sure there's a place to have them drop off, helping organize them when they're dropped off, get them to the events, and make sure there's a safe place for them to be picked up later. Routing software, obviously with a bunch of requests in different locations, you're going to need a pretty complex routing software. And then establish priority needs system, see who's got the highest needs. Obviously, I just want to go downtown versus I would really like to go to the grocery store. I really want to go to this community event that's happening at this exact time, right? And then sometimes to address this, you could do scheduled routes, especially around if there's an event happening, having extra rides, to get to that local event, or maybe a grocery store day. Mondays, you go to the grocery store. Wednesdays is a park day. How we know it worked? Well, you could do a nice SMART goal. In the first 12 months program, at least 100 residents are being served by this. 90% ride completion, a reduced social isolation and loneliness reported in the individual's user service, and a 10% reduction in the Kessler-6 psychological distress score. The reason I chose this is because it's the one they used to actually create the baseline data in the 2030 goal. For the measures on this would be that K6 study, and you could use this through follow-up surveys conducted with the providers who initially referred them, because they would have some of their initial scores and they could see if there's been a change. And then obviously just seeing community participating in this and seeing the program actually take off would be a good measure of its success. In conclusion, depression and loneliness are an important concern in Austin. There's obviously populations at risk for it there. They report higher than state numbers on some of those things. Austin has many strength and protective resources that are already established. There's been great investments in that, but transportation to these resources remains a barrier. The public health intervention could reduce this transportation barrier, and that would be a system level intervention. And then this would also build on the already established strengths that Austin has. It's helping its people with. And then kind of something that I learned about this was kind of cool, was that there is an incredible number of public resources and efforts already being made. Check out this Discover Austin link I have here. They have some really cool stuff. Even like the local Nature Walk Center has like these almost like tank looking power chair cars, so people with disabilities can actually go enjoy the big nature walks there, and they have them for free to people. So this was the community advocacy fact sheet I created, kind of like a call to action, nice poppy letters, kind of defining the problem. That's, you know, what transportation is, how it's affecting Austin, how we reported it. Here I link, you know, transportation, how it builds into all these other factors. That's a big upstream factor and as a social determinant of health. People and businesses have already created, kind of highlighting the strengths are already there. Austin's already done such good work, you know, to highlight the strength that's there. Let's just help people get to it. Obviously describing who's at risk here, our most vulnerable populations, the proposed solution, all the different types of stuff that I explained there earlier, our expected benefits there, and then the call to action. Let's talk to these people here about this, see how we can get this rolling. And of course, a little cool reference sheet there. Then here's my reference sheets for everything here. There's some really good references, some big studies on this. I didn't know loneliness is quite as much of an epidemic as it is. We've probably heard that before, the epidemic of loneliness, but 1 in 3 adults reporting it. It's kind of crazy, especially in an age of social media, which almost seems to have negative effects on it. There's some other resources. Thanks.